Hello everyone, my name is Yantian Poquie, and I'm going to talk about my experiences at my practicum and at the Pennsylvania Department of Public of Health, Office of Health Equity. Welcome. Why worry when everyone has the opportunity to attain their highest level of health through health equity? What is health equity? It is the opportunity for everyone to attain his or her full and excellent health potential. Understanding health. Health, by definition, is the state of complete physical, social, and mental well-being, and not merely the absence of disease or infirmities. Understanding public health. Public health is what we as society do collectively to assure the condition in which all people can be healthy. Health monitoring requires selecting relevant health indicators, obtaining data, analyzing the data, reporting the results, and implementing the changes. Who does health equity serve? Health equity serve our communities, it serves people with disparity, it serves people with health inequalities, and people with social determinant of health. I have some pictures for you on the slide, as you can see. What does health equity provide? Health equity provides peace, shelter, education, income, etc., and etc. Factors that determine health. There are many factors that go into determining a healthy individual. That covers the biological background, social and economic factors, healthy behaviors, clinical care, and many more. Social determinant of health. And a great example of the social determinant of health is from the Pennsylvania Department of Health Equity here. It relates diabetes to income level. As you can see on the graph, there's a very big correlation between diabetes and health and income in Pennsylvania in the year 2010. Health inequalities. Differences in health status between more and less social and economically advantaged groups caused by systemic differences in social conditions and processes that effectively determine health. Structural inequalities. There are structural inequalities in society that affect health, such as example will be in an urban classroom versus a suburban classroom. As you can see from the picture, the sizes of the number of students in these various communities in the classrooms are different, with high amount of students in the urban classroom. Who's affected by structural inequalities in Pennsylvania? In Pennsylvania, African Americans, American Indians, persons with mental health challenges, senior citizens or older Pennsylvanians, as well as immigrants, and many more people are affected by structural inequalities. The purpose of my practicum was to collaborate with Pennsylvania Department of Health staff and external evaluation contractor staff in assisting with the Office of Health Equity by taking a large role in reviewing, collecting data, disseminating these data, and to help provide a solution to issues of growing importance to American families. The goal of my practicum was to provide leadership that increased public awareness of health disparities in Pennsylvania, work with policymakers, insurers, healthcare providers, and community to implement policies and programs that result in measurable and sustainable improvement in the health status of underserved and desperate population. The overview of the PA Department Office of Health Equity. The goal really is to address inequalities, health disparities, significant differences in health status, delivery of health services, and utilization of health services. The office works with policymakers and insurers to provide these care. Overview of PA and the continuation of the overview of the PA Office of Health Equity. If we are not all healthy together, none of us is as healthy as we could be. That's the motto. What are the benefits of my practicum? To help people get access to economic and educational opportunities, have the capacity to make decisions and affect changes for ourselves and families and our communities, and to encourage the community that working together can create economic, social, and environmental conditions that promotes health. Continuation of the benefit of my practicum was to also provide social and environmental safety in places we live, work, learn, and worship. So such as looking at housing data, looking at crime statistics, and school fundings in various counties across the states. Another benefit was a cultural benefit, evaluating the competent and appropriate service when the need arises, such as looking at banking and access to health or mental health care. The PA Office of Health Equity approach was to collaborate across the state with county offices in data sharing, strengthening relationship and existing relationship, and acknowledging solutions that will collaboratively develop and we can implement together. Conclusion. The public understanding of what creates health. Some health is very important in the state. That's one conclusion of my research. Another aspect of my research was to increase public agenda. That is, we create expectation that we can and will address these conditions based on data and results gathered across the counties in the states. We presented, and another aspect of my research or practicum was to present the data to policymakers to influence resources that can make a lasting impact in the communities that are impacted. And further aspect was presenting the data to nonprofit organizations, as well as increase awareness in various communities impacted by the data to create more policies and programs. For example, community parks. We looked at how many parks are in Chester County, for example, and we narrowed it down to places like Norristown to see how many parks are in those areas, and how that having more parks will increase people's ability to get outside and exercise, and that impact the level of obesity in the long term. That's a practical example of of some of the data we were looking at. In conclusion, I'd like to thank Mr. David Sanders of the Pennsylvania Department of Public Health for his support in allowing me to do my practicum at his office with the Department of Health. I also like to thank Dr. John Ezekzi for his support and encouragement through all this coursework. He was a mentor, and I appreciate his help. Thank you, and I hope you had a great presentation.